Hey everybody, I'm John Hammarley with the Plastic Surgery Channel. And I thought last year was big when we got numbers from the Aesthetic Society saying that Americans spent $6 billion on plastic surgery. But they've just come out with a release about 2 weeks ago saying that between January and July of 21, we're spending $8.7 billion. Now, there's nobody better to address this issue than Dr. Bill Adams. He's the president of the Aesthetic Society. Bill, what is the reason why we're spending so much money on ourselves?
Well, John, I think it's several things. Obviously, COVID had a lot to do with the initial kind of pent-up demand that we saw, and rebound effect. But that was, late spring of 2020, and we've seen the sustained interest and growth of plastic surgery procedures, both surgical and non-surgical. And I think that there are definitely some things related to the pandemic. There's people have more expendable income in the sense that they weren't going on vacations, or maybe they had to cancel their vacation.
Going out to dinner.
That's right. Yeah. So, but the other thing is that we have seen this as growth in plastic surgery and interest in plastic surgery for at least 10 years. And that growth has been consistent, and I think we're seeing more and more of that. People are interested in looking good. They're interested in feeling good. That is something it's not unique to the pandemic, although maybe the pandemic added to it. We're on Zoom calls right now, so people saw themselves on Zoom. So all those things added together, I'm not surprised at those statistics, but I think that they're true, and I think they're going to continue for the foreseeable future.
Do you see both the growth in non-surgical as well as surgical procedures?
Absolutely. We have really seen a big increase in both of those. The non-surgical has always been a very fast-growing area with injectables and neurotoxins and similar procedures. There's a lot of other new non-surgical things: fat removal, skin tightening, cellulite things that have come, technology have become available in the past few years. So those have had great growth. But the surgical procedures have, the old mainstays like breast augmentation, liposuction, breast lifts, facelift. Those things have continued to grow, but then there's also other procedures like Brazilian butt lift, buttock augmentation that has grown.
And more men.
Male plastic surgery has been a huge growth area. They look great, they feel good, and they keep coming back for it, so they must like it.
And you guys were, I remember when the pandemic first hit, all your offices shut down. You guys were worried for a little while before then the tsunami of demand came.
Yeah, a lot of plastic surgeons, including myself, is very uncertain. You're like, well, what's going on here, and what's going to happen? Because we all had offices, we all had staff, and nothing's going on. So we're kind of a unique business because our business doesn't thrive unless we're working and doing surgery or doing procedures. But just like most things in life, they work out with time, and I think most plastic surgeons are really kind of seeing this growth that you're talking about, and so people have been extremely busy the past year and a half.
Bill, do you think that part of this boom, Zoom boom, whatever you want to call it, has something to do with the fact that it's easier, it's more convenient to recover from a procedure at home?
Yeah, I think so. I mean, that whole dynamic to me has been...
When you don't have to have the demand of getting right back to the office.
Yeah, I mean, and people have seen that in terms of every facet of life and business, I think, has seen that transition of doing things from home. And I think it's been a little bit controversial, I think, for a lot of businesses, because a lot of people, including myself, think that for productivity is clearly not the same at home as it is in the office. But what you're talking about is something different. For us, yeah, I mean, I think for sure people have become much more accepting of plastic surgery procedures, maybe recovery. it used to be 20 years ago, nobody talked about their plastic surgery. Now
Right.
they're considered weird if they don't talk about the plastic surgery they've had. So it's definitely different, but absolutely. I think if you're spending more time at home, it's not that big a deal. Oh, well, I'm fine. If I have this bruising, I don't have to worry about putting makeup on it or whatever, and I'll just recover at home. And so I'm sure that's giving people, I think, accessibility to recovering in a more private area like you're talking about. That's added to some of this. I think the other thing is people's just available time they have. I think people just have more time regardless of what that reason for that is, but they have more time to do the procedures and recover.
Well, given the fact that we're spending nearly $9 billion in 6 months on plastic surgery, I know you're busy. I really appreciate your time. You probably have to get back to the surgical suite. Dr. Bill Adams, President of the Aesthetic Society, thank you very much. If anybody's got any more questions about this or any other issues about plastic surgery, go to theplasticsurgerychannel.com.